Howdy, I want to thank you guys for joining me today. My Poop Tip Tuesday. We have a great show tonight. I want to apologize for being late. I got caught up in something. But in tonight's video, we're going to talk about sleep, the importance of sleep, and does sleep lead to weight gain, and what I recommend to help out with sleep. We'll talk about liver diseases, specifically hepatitis, and we'll talk about celiac disease, gluten issues, and any questions you guys may have on today's live video. Guys, let's go ahead and talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, let's begin today's show. So once again, I want to apologize for being late. If you're joining me for the first time, my name is Dr. Islam, and yes, I'm an actual poop guru. Yes, my passion is to give you, yes, you, the best tips and tricks so you can live your best life. Every other Tuesday, the first Tuesday and the third Tuesday of the month, I go live on the social media streams and answer your questions you guys may have and to delve into a topic you guys had asked me about as well. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my weekly newsletter so you can know when I'm going to be going on live and what information I can give to you straight to your inbox. So I need a favor from you guys. If you're watching this live or on the replay, comment down below. Let me know where you are watching this, if you're watching live or on the replay. And also let me know where you're watching this video on as well. Are you watching it in Lubbock, maybe outside? I love to hear where my audience is. And if you have a question for me as well, comment down below. I can hopefully get your questions at the end. Amy, it's great seeing you. Thank you for watching on the live stream. It's good seeing you, Jim. Thank you for watching the live stream as well. All right, let's delve into today's topic. We are going to talk about, the first one is sleep. Number one, is there a connection between sleep and weight loss? So this is a very good question that I got. And so let me know in the comments if you think there is a connection between lack of sleep and gaining more weight, because I will tell you what the answer really is. Nadia's good watching as well. Judy's good seeing you. Jamie's good seeing you guys. Rose, good seeing you. Thank you guys for watching on the live stream as well. So do you guys think there's a connection between weight loss and sleep? The answer is yes, absolutely there is, 100%. So why is that the case? So we know that if you don't get good sleep, you're going to actually gain more weight. In fact, for a lot of my patients, this may be the secret ingredient for them to lose the weight that they want to lose, because they're so frustrated by the amount of weight that they have that by manipulating their sleep, they're actually able to lose the weight that they can't lose. Those pesky 5 or 6 pounds, 5 or 10 pounds. Why is that the case? Well, number one, if you are sleep deprived, there is a higher chance of you eating those foods that make you feel good and make you just be like, oh, that was so good. And guess what kind of foods those are? Those are foods that are high in calorie, high in sugar, bad carbohydrates. They're not good for your gut. They're not good for weight control, but they make you feel so good, and you lose that capability to not eat the good foods that are better for weight loss. Number two is that you have a higher dosage of cortisol, which is a stress hormone. Cortisol, or also adrenaline, is one of the hormones that are produced when you're in a stressful mode, whether you're in fight or flight, or if you're lacking sleep. Because when you're lacking sleep, you lose the capability for your body to rest, and that can also jack up your cortisol and make you more likely to cause you to metabolize fat differently than what you would want. Number three is that you actually lose your inhibition whenever you lose sleep. So for example, let's say that normally you're a very disciplined person, you eat the right things and you stay away from the bad things, but when you lose sleep, you lose that inhibition. You just be like, oh, forget this, I'm going to eat whatever I want. I'm telling you, this happens to me all the time. Whenever I'm low on sleep, I'm low on fuel, I'm low on energy, and I just sometimes don't give a flip, and I'll just eat that bag of potato chips, go crazy, not a big deal. Then lastly, when you don't have enough energy, you don't have enough, or if you don't have enough sleep, you don't have enough energy to do physical activities. You don't want to go on a run. You don't want to work out. You don't want to do the things that you normally should do to be physically fit. So there are multiple reasons why losing sleep can actually make you gain a lot more weight. And by tweaking your sleep and making that better, for a lot of my patients, they are able to get over that hump, allow them to lose weight, feel better, and to really have a better control over their weight issues as well. So question number 2, hey, Dr. Islam, all right, if I'm talking about sleep, what do I recommend as a doctor to help improve sleep? So I've been obsessed with sleep for a long time. I had terrible sleeping habits. I was up all the time. I had caffeine in the middle of the day. I had poor sleep habits, but I knew this is really affecting my quality of life, my life at home, and also just how I felt. I did not feel good when I did not have enough sleep. So I really dug into the research on this. Here's what you need to do. Number 1 is that you have to establish a consistent sleep schedule, including on the weekends. I know the weekends are a time when a lot of us just want to sleep in and kind of catch up on our sleep. Well, I can tell you by doing that, you're going to make Monday and Tuesday a lot more difficult. You need to have a consistent bedtime every single time, every single day forever. This is what you need to do, because if you have this yo-yo sleep time, your body's not going to get used to it, and your body is going to be wondering, hey, I don't know exactly when I'm supposed to be tired or what is going on. Number 2 is that you need to eliminate caffeine after noon. So I don't drink any more caffeine afternoon, like literally at 12 o'clock. That's when I don't have any more caffeine after that. If you start to creep in that caffeine later on in the day, that's going to affect you. Even if you don't think you're getting affected from this, I can tell you you are. So you can cut back on that caffeine and cut back on that jolt of the energy that's there. Number 3, I would recommend highly for you to turn off all blue light devices at least 1 hour before you go to bed, including your iPhone, iPad, and your computer. Don't get tricked into thinking that you're not immune from the blue light emanating from your device. I can tell you that you are, and that causes you to not be able to sleep, and that causes more and more interaction and activity going on inside your head to make it less likely for you to sleep, to make it more difficult for you to have a good night's rest. Number 4, I would recommend for you to keep your iPhone away from your bed. Too many of us sleep with our iPhone right next to us. It's almost like a spouse. You don't want to do this. Keep your iPhone maybe in a different room, maybe far away. My phone is far away from when I sleep, and the only reason I have it in my bedroom in case I have a call from the hospital or a patient that I can answer, but beyond that, I try to keep this as far away as I can. Number 5, it's recommended for you to sleep in complete darkness. I have blackout curtains. They have been a game changer when it comes to my sleep. Let me know in the comments if you tried blackout curtains or not, because for me, it's been a game changer. I've used this tremendously to help out with sleep. And then lastly, my bed is cold. Yes, I have a very, very, very cold bedroom. My wife hates this. She doesn't like it, but guess what? It helps me sleep, helps her to sleep, and I can tell you this has helped out. But if you follow these little steps, these are things that are going to help you sleep. If you can sleep better, it's going to improve your weight loss journey as well. Like I mentioned before, it tends to be one of the key things that I recommend when it comes to sleep pattern. All right. Judy's good seeing you. Jamie's good seeing you. Rose is good seeing you. Gracie's good seeing you. Margaret's good seeing you. Missy, it's great seeing you. Taz, thank you for watching. Natalie, thank you for watching as well. All right. Perfect. Basilian, good question. I'll answer. Rabina's good seeing you. Thank you for watching right now. Francisco, thanks for watching as well. Perfect. Judy, the good watching as well. Thank you guys for watching on the live stream. All right. So my last topic on sleep is regarding sleep apnea. So next question, hey, Dr. Islam, what do I do, or what should I do if I'm worried about sleep apnea? So sleep apnea is literally whenever you stop breathing when you sleep. It is such a scary phenomenon for a lot of people to suffer from. And the problem is that a lot of people don't realize that they're actually suffering from this themselves. More often than not, it is your spouse that's trying to wake you up to get you going so you can breathe, or you're snoring very, very heavily. And the problem with undiagnosed sleep apnea is that over time, it can lead to heart problems, lung problems, and can lead to sudden death in individuals. And this is a very important fix that we need to do, because if you can fix the problems with sleep apnea, not only will your sleep get better, but it decreases your risk for developing long-term problems like heart issues, lung issues, and other issues. So here's what you need to do. Number one, if you were worried about that you're stopping breathing whenever you're sleeping or you have sleep apnea, see your healthcare provider. You have to do this, because there are certain tests that we can do to see if you actually have a problem with that. And with those tests, we can determine what options we can do to get that taken care of you, including things like weight loss, quitting smoking if you smoke, trying to treat allergies, or sometimes you actually may need a sleep machine like a CPAP machine, or sometimes even surgery as well. These are options that we can do to help control sleep apnea, get it better, nip it in the bud so you don't have any problems sleeping, and you can prevent the long-term complications that can occur with sleep apnea. All right, guys. Perfect. Let me go through some of the comments here. So Taz, good question. Is there a correlation between PCOS and gut issues? Yes, there is. So PCOS is polycystic ovarian syndrome, and this is a very common condition in which a lot of individuals have, and this can really cause a lot of gut issues as well. Sometimes you have what's called endometriosis, and those endometriosis implants can actually implant inside the gut to cause pain, constipation, gut issues during periods whenever you're having your cycle. And unfortunately, the only way to really know this is for an OB-GYN doctor to look inside your body to see if you have those endometrial implants that are there. They may be in the colon. You can zap those off. But there are other conditions associated with PCOS as well, including constipation, irritable bowel syndrome, reflux, heartburn, and sometimes treating the root cause of PCOS can also help eliminate or minimize some of the gut issues that you may be having as well. So yes, there's a correlation between those two things. Great questions. So Baseline, it's a very good question. Do I recommend SSRIs for functional dyspepsia? How does this help the pain signal treatment? 100% we do. And so SSRIs are medications that we use to help treat what's called abdominal pain. For a lot of our individuals or a lot of our patients who have abdominal pain, sometimes what happens is that the nerve fibers are so jacked up, the volume is way loud in the radio that is inside your GI tract. Your nerves are on fiber, that the only way to fix those gut issues is to turn down that volume to make it normal again, to help turn down that radio, decrease those nerve fibers, and to minimize the signals that are going on. And one of the more effective treatments that we have are small, low doses of antidepressants. Now, what I stress to my patients is that we're not treating depression. I'm not treating you for that. In fact, the dose that we give you doesn't actually treat depression. What it does do, it turns down that signal to make it lower, to help you to help out with the pain, help out with the jacked up nerves that are going on inside your gut, and to make people feel better. And I will tell you, this works effectively, and it works really, really well to allow my patients to handle the pain and to have a lot of relief from their gut issues. Great question. All right, let's go into our next topic. Hepatitis. So let me know in the comments down below, have you known somebody who's had hepatitis? Have you been diagnosed with hepatitis yourself? Question number one, hey Dr. Islam, what is hepatitis? Well, the medical definition of hepatitis is actually inflammation of the liver. So we can see this from a couple different ways. Sometimes we can see hepatitis based on the symptoms you describe to us. So for example, you start to all of a sudden have flu-like symptoms. Maybe your eyes are turning yellow, or your skin is turning yellow, or your urine is turning dark brown. This could be a symptom of hepatitis. But in most individuals, we can see this based on blood testing that we do for you. And these blood testing will allow us to actually see inflammation going on inside your liver. And the generic term for that is what's called hepatitis. So question number two, hey Dr. Islam, what causes hepatitis? Well, the most common causes are probably ones that you recognize, including viral hepatitis. So there are viruses that can actually attack your liver that cause inflammation to occur. Things like hepatitis A, B, C, D, and E are other viruses. Sometimes cytomegalovirus or HSV can cause inflammation as well. Sometimes medications can cause hepatitis as well, or inflammation. The most common being these supplements that people are obsessed about can really damage your liver and cause a hepatitis to occur. So if you're taking a supplement, be very, very, very careful about that. Sometimes taking too much Tylenol causes hepatitis as well. Sometimes there are also autoimmune causes of hepatitis as well, in which your body actually attacks the liver to cause inflammation to occur. And there are blood testing and imaging tests that we can do to see if that is the case. So, question number 3, hey, Dr. Islam, if I'm worried about hepatitis, what can I do today to help prevent this? Well, I kind of mentioned this. Number 1, if you're taking a supplement, you need to be very careful about this. Too many supplements are out there that are not regulated and unfortunately can cause a lot of liver damage in a lot of our patients to the point where they actually need to have a liver transplant. I have sent patients for a liver transplant based on these supplements. So if you're taking something like that, be very, very, very careful and make sure you speak to your doctor. Number 2, you need to minimize those risk factors that can give you a hepatitis, whether it's sexually transmitted diseases or IV drug use. If you're doing that, or if you're not having safe practices, this can lead you to develop a hepatitis as well, especially a viral hepatitis. Number 3, get your vaccine. So there's a hepatitis C vaccine that's out there that we typically give. Sometimes you get vaccines against other viruses as well. Get your routine vaccines, be up to date on your immunizations. This will help prevent you from getting a hepatitis. Number 4, if you're traveling, make sure you're very careful about where you eat, because that's another way where you can get inflammation of your liver, in which you can get a hepatitis in certain foods that you ingest can go into your liver and cause inflammation to occur. And obviously, if you're drinking water, make sure you drink bottled water, especially if you're traveling, or make sure you boil the water as well. These are very common areas or reasons why people can have inflammation in the liver from having these particular foods that are not clean, or maybe an environment that's not good for you. And then lastly, guys, you know this, wash your hands. Yes, washing your hands will help prevent any viruses from coming into you, whether it's a bacterial virus or whether it's a bacteria or a virus, which can possibly invade your liver to prevent this inflammation from occurring. These are small little tips that I recommend for my patients to help them prevent a hepatitis or liver inflammation from occurring. Great question. All right. So let's ask a couple more questions here. So Natalie asks, hey doctor, how can stress cause stomach pain? In the long run, can it cause stomach ulcers? It's a very good question. So stress is such a big problem when it comes to gut health. And what I tell a lot of my patients is that it can end up being a vicious cycle. What happens here can manifest here. What happens here can manifest here. And it can just end up being over and over and over again. And sometimes fixing what's up here will fix what's going on inside your belly. And that stress response can really cause inflammation to occur. It can increase your stress hormones, cause you to have more contraction, make your nerves more sensitive to certain foods or certain environments. And if you don't address that stress, it's very difficult for us to really help to manage what's going on with the pain, because the root cause of your pain may be stress, and that can cause a lot of gut issues to occur, including diarrhea, pain, nausea, vomiting, and irritable bowel syndrome as well. And this is why sometimes managing that stress may be a treatment option for a lot of patients. All right. Perfect. All right. So last topic, we'll talk about celiac disease and gluten. So let me know in the comments, have you guys heard about this? I'm sure you have, because apparently talking about celiac disease and gluten is pretty much everywhere. A lot of patients want to go on a gluten-free diet for various reasons. So question number 1, hey, Dr. Islam, what exactly is celiac disease? So celiac disease is an actual autoimmune disease whenever you ingest gluten. And that autoimmune disease actually causes your body to attack the small intestine to get rid of what are called the villi in your small intestine. So your small intestine have these little villi that are there. And what they do constantly is that they're constantly absorbing food, nutrients, and vitamins. If you have celiac disease, that gluten will actually cause you to shear off those villi that are there because of an autoimmune response. and that can cause people to have a lot of gut issues whenever they ingest gluten. And it can lead to vitamin deficiencies, anemia, B12 problems, and also at some point in time has a chance of progressing into lymphoma as well. So question number 2, hey Dr. Islam, how is celiac disease treated? Well, it's a very easy treatment. You avoid gluten. That's it. If you avoid gluten, those villi will come back, they'll form again. You won't have the long-term complications of celiac disease. You'll get nutrition back, you'll get your vitamin problems back, and you minimize that risk of developing lymphoma. It's as simple as that. You avoid gluten, you actually can cure your celiac disease, and you can make people back to normal. So big question number 3, it seems like everyone today is allergic to gluten. So what exactly is the difference between celiac disease and a gluten allergy? Let me know in the comments down below if you've wondered this yourself, because I get this question all the time. In fact, it's one of the more common questions I get on YouTube, Facebook, Instagram, and Twitter. What is the difference between celiac disease and a gluten allergy? Let's get down to it right now. So, number 1, celiac disease is an autoimmune disease. Your body attacks itself, and that's what's going on. A gluten allergy or gluten sensitivity is not an autoimmune disease. There is no actual damage that's going on inside your small intestine. Now, there is a thought you may be having what's called leaky gut with gluten allergy, but we don't have a lot of good significant evidence yet that's the case. Number 2, you can diagnose celiac disease with a blood test. Absolutely, you can. We can do certain blood testing to see if you have celiac disease or not. And this allows us to see if you have that autoimmune disease to attack your body. For a gluten allergy, we cannot actually diagnose this with a blood test. No matter how many tests that are out there for food sensitivities, they are not accurate, they don't work, and I can tell you, it will not tell you if you have a gluten allergy. Number 3, having celiac disease, it can lead to long-term problems, including low blood count, low vitamin B12, vitamin D, calcium, and like I mentioned before, it can also lead to lymphoma. Having a gluten sensitivity does not lead to that. It doesn't lead to vitamin deficiencies. It does not lead to anemia. It does not lead to lymphoma. It does not cause that at all. And then number 5, the symptoms of both those two conditions are pretty much the same. Nausea, vomiting, diarrhea, bloating, upset stomach, indigestion. Their symptoms are the exact same for both these two conditions, and the treatment is the same as well. You can avoid gluten to help out with both conditions. But I will tell you, for the vast majority of people who think they have a gluten allergy, it's not actually that. What the actual allergy may be are FODMAPs. This is the critical thing. A lot of people don't realize is that they cannot tolerate FODMAPs as opposed to gluten, and gluten is a one component of FODMAPs. So FODMAPs are fermentable oligosaccharides, monosaccharides, and disaccharides, and polyphenols, which are a very common source for a lot of gut issues for a lot of our patients, whether you have celiac disease, gluten sensitivity, IBS, or things like that. And by putting patients on a low FODMAP diet, they do tremendous in terms of getting their gut issues better. So if you are worried that you may have celiac disease or gluten sensitivity, come see somebody like me. We're an expert on this. We can diagnose what it is and hopefully give you a better treatment plan to get this taken care of for you. All right, guys. Perfect. All right, let me go through some more questions here. So Zach, good question. Barrett's inflammation causing serious sleep disruption. Any advice? So number 1, if you have Barrett's esophagus, my first recommendation is to make sure that you are on an acid medication. You have one of the very few indications here for you to be on an acid medication. Number 2, consider lifestyle changes. I will tell you lifestyle changes do work. Avoid some of the trigger foods, including things like spicy foods, coffee, caffeine, chocolate. Minimize that. Number 3, avoid late night meals. Number 4, if you smoke, don't smoke. And number 5, try to make sure that you manage stress, because stress, we know, can make reflux symptoms a lot worse. All right, guys, perfect. All right, I want to thank you guys for watching. I think we had a great audience today. You guys had some great questions. Don't forget, if you haven't already, to sign up for my newsletter. Smash that like button. Let me know if you're watching this live or on the replay and where you're watching this on. And tune in about 2 weeks for my next Facebook Live. If you have a question for me, send me a message, send me a DM. I love to hear what you guys have to say. I want to thank you for watching. Share this video if you know somebody may benefit from this. And once again, I really do appreciate you guys talking and being on today's live stream. Hope you guys have a happy and healthy day. And as always, don't forget, let's talk about poop. Yes, my little poop emoji. Thanks, everyone. Take care.